Hi everybody. This time for this video, I thought I'd do something a little bit different. I'm sure, like many of you, for the last 4 to 6 weeks, I've been using video conferencing a fair bit, and so I thought I'd do this video in the style of a video conference. And the topic for this video is to look at how we could potentially use occupancy modelling type thinking and approaches and apply that to COVID-19 or perhaps some other situation where we have a virus or a disease or some sort of pathogen of interest within a population, just to think about how can we use some of these techniques we apply fairly regularly in ecology to ask some different questions in a different setting, and in this particular case it's about disease or a virus in the population. So firstly, for occupancy modelling, just a quick recap if you're not familiar with it. Then it was developed for looking at the presence or absence of a species. And so the idea is you'd go out to a number of different places, you'd do searches for the species, and you either detect the species or not at those locations. Now the thing is for many species is that you don't always detect it perfectly. So the species may be present, but you don't detect it in your searches, in your surveys, and so you have the potential for false absences. And so occupancy modelling was a set of techniques that was developed to try and address that. And what you can do with occupancy modelling is we can bring in information to try and look at how does the presence of the species depend upon other features. So you can bring in covariates. So for example, it might be, how does the habitat type at certain places affect the presence or absence of the species? And we can also do that for detection. So our probability of detecting the species, if it is present at a location, we can make that a function of covariates as well. And they can either be the same or a different set of covariates for what we use to look at the probability of the species being present. Now we can also use random effects. So we could assume a distribution for how the probability of occupancy or detection varies from one site to the next, and incorporate that into our modelling as well, just to try and allow for perhaps other sources of variation in these probabilities that we're not modelling with the covariates. These techniques have also been extended to account for false positives. So for the situation where perhaps the species isn't present at a location, but when you're doing the surveys, you mistakenly record it as being present. So it might be, a very similar species has perhaps called, and so you record it as the species that's of interest. So you've done so mistakenly, or there could be some other sort of error as well. But the idea is that we don't always detect the species perfectly, but we don't always not detect the species perfectly either. Sometimes we have misidentifications. And occupancy modelling is quite a broad suite of techniques now. So there's techniques that look at just the static situation, so looking at the probability of occupancy or the distribution of the species at one point in time. But then also there are these dynamic models that then allow us to look at how does the level of occupancy change over time as well, and what factors might be driving that. Are there some types of places where the species is more likely to persist and stay through time, and are there other types of places where the species is more likely to go to and sort of colonize those locations as well. So that's kind of a real quick introduction to occupancy modelling. And just want to sort of draw the parallels that we have with situations like COVID-19. And there's many other conditions as well that this could be pretty applicable for. So the basic idea is that, again, it's a presence-absence type situation. People are either infected by COVID-19 or they're not. So we have this sort of presence-absence situation. Our tests that we have for COVID-19 are not perfect. I'm sure if you've been following the news over the last few weeks, you would have heard talk about sensitivity and specificities of tests. And so the sensitivity is how good are these tests at detecting COVID if someone is infected with COVID-19. And so it's the probability of a correct detection. It's the probability that the test detects COVID if that person is infected. Now, different tests have different efficiencies. So I've seen some reports of some testing procedures that might have a sensitivity of sort of 60 to 70%, other places up towards 90%. And if you think about it, if that sensitivity is only around 60%, that means 40% of cases, 40% of people that are infected with COVID-19 are not getting diagnosed correctly if they have just a single test. The specificity, okay, so that is the probability of a true negative rate. Okay, so if the person does not have COVID-19, it's the probability that the test result says it's a negative and says that they don't have COVID-19 as well. So the opposite of that, or the complement of that, is our false positive rate. So specificity is the probability of not having a false positive, but 1 minus that is the probability of a false positive. So it's the probability that the person didn't have COVID-19, but actually the test result came back as a positive and said that they did. Now specificities, again, the numbers I've been seeing in the media are up around sort of 90-95%, which is pretty good. What that does mean is that there's about a 5 to a 10% chance that a person doesn't have COVID-19 is getting diagnosed with COVID-19. So again, if you have lots of people out there that aren't infected, and hopefully that's a lot, now there's about 5 to 10% of these tests are coming back as positive, perhaps incorrectly. And those are both things that we know how to deal with occupancy modelling. We know how to deal with false positives, but also the negatives, the false absences, the false negatives. We know how to deal with them in occupancy modelling framework as well. One is just detection probability, and the other is the false positive rate. Now, the infection rate will probably vary amongst individuals. The probability that a person has COVID-19 will depend upon, well, it appears to depend upon their age, perhaps where they've travelled to, their occupation, whether a health worker, a school teacher, or things of that nature. So there's lots of coverts or predictive variables that we could potentially bring into an analysis to look at how COVID-19 is infecting people across populations. The effectiveness of the test, again, they've done laboratory experiments where they have some idea about what those specificities and sensitivities may be like. But again, they're going to vary across a large number of factors. Okay, it might depend upon the severity of the infection in a person as to how well the test might detect it, the COVID-19, if it is present. The location of the testing, whether it's a blood prick or a blood drop that they take from a prick in your finger, or whether they put the testing thing up your nasal passages. There are a number of different ways that test effectiveness could vary. And again, we can bring those sort of test sites in as covariates, or the method of testing as covariates into an analysis. And an advantage of this is that we can sort of collect the data that's relevant to the population of interest that we're collecting data on. Another question that people have about COVID is, how does that infection status change over time? At the moment, people are primarily thinking that you just catch it once and then you sort of you become uninfected after a certain amount of time, but then there's potential for you to get reinfected as well. So the idea might be thinking more about these COVID-19 dynamics, either at the level of an individual person, or perhaps at a larger population scale as well. Okay, so what would we have to do to start thinking about using occupancy modelling techniques as a way to monitor for COVID-19 or any other type of disease that has similar characteristics? The first thing is that to get this idea of detection probability and to also get information about false positives is we need to have some repeat testing of people. We don't necessarily have to test everybody repeatedly, but we do need this idea of repeat survey information, because that's what we use in occupancy modelling to allow us to get at detection probabilities and false positive rates. So we need to have people to be tested not just once, but actually multiple times by these different testing procedures, or it could be the same testing procedure applied multiple times. Again, it doesn't have to be everybody, but we need to have some sort of information from the population about these testing procedures. One advantage we could do using Bayesian methods of statistics, Bayesian methods of inference, is we could use the information we already have about specificity and sensitivities into the analysis. We can bring in this information that people have already done some prior work on and bring that in as prior distributions on our detection and false positive rate parameters. Although, again, a lot of that information has been collected under laboratory conditions, and yet we might be trying to apply this to the real world situation, looking at where people are now in terms of their COVID-19 infection status. And like I said before, one of the key things about this is if we applied this in the real world, is that all the information we'll be collecting and all this information about sensitivities and specificities will be relevant to the people being tested. So we won't be just using results that are assumed to be correct from laboratory studies or perhaps things from outside of that real world application. We'd actually be trying to collect relevant information that allows us to make better conclusions about our populations that we're collecting the data on. And we can use the results to then sort of work out, given a particular test result, is that person really infected or not? Now, we can't say for certain which way it will go, but we can start assigning probabilities to it. You know, that may, whether that has much effect on how we would treat that person is another discussion. But certainly there are things that we can do with our results to try and get a better idea about what's going on in the population. Now, obviously, some of these testing procedures aren't cheap. If we're talking about trying to apply them repeatedly to different people, then that might get quite expensive quite quickly. There's also issues about how do we do the sampling. You know, at the moment, a lot of the testing is just done by sort of convenience sampling, people that think they've got potentially COVID-19 and they're self-reporting to these different places. So exactly what the population of interest is, or at least the population that our results apply to, will just take a little bit of thinking. But again, these are sorts of questions that epidemiologists are struggling with already and thinking about all around the world. So there you have it. That's all I've got. Hopefully you found that perhaps interesting. And yeah, think about how we potentially could apply occupancy modelling to COVID-19. Thanks. See you later. Bye.